My name is Dori Rosinda, and I am a proud member of the Board of Directors of the Health Improvement Partnership of Santa Cruz County, and an incredibly proud member of the team at Salud para la Gente, many of whom are here this evening. And it is really my tremendous pleasure and honor to introduce our keynote speaker tonight, Dr. Zayna Khayat. Zayna is a future strategist with St. Elizabeth, which is a health and social impact enterprise with a major focus on home care in Toronto, Canada. And if you think about that title, a future strategist, you might wonder, how does one become a future strategist? I'm going to tell you. You start out by studying biochemistry at the University of Windsor, where Zayna received both the President's and the Board of Governors Medal Awards. She went on to receive her PhD in biochemistry from the University of Toronto and Hospital for Sick Children, where she was a scholar of the Canadian Institutes of Health Research and Diabetes Research. She went on to consulting on health and business strategy and management with the Boston Consulting Group, or BCG, and Secor Consulting, KPMG, both who are global management consulting firms, and she worked with medium and large-sized public and private health and life science organizations in Ontario and nationally. She has been on the faculty with International Center for Health Innovation at the Ivey School of Business at Western University, and currently is adjunct faculty with the Rotman School of Management in the Health Sector Strategy stream, where she teaches a health MBA course on healthcare innovation, and is on faculty with Singularity University and Exponential Medicine. It's hard to, these are all, of course, names of universities that I've never heard of because they're in Canada, but maybe some of you have, and it's an amazing resume. She has recently spent a year with Reshape Health Innovation Center at Radboud University in the Netherlands, where she led several initiatives to advance health innovation in the country. She led health system innovations with Mars Discovery District, which was a major innovation hub based in Toronto, worth Googling. At Mars, Zayna and her team helped smooth, that's capital M, little a, big R, big S. They led smooth the path to adoption of innovation by healthcare systems in Ontario and around the world. She has more than 10 publications and chapters in international journals and textbooks, and she is trilingual in French, English, and Arabic. I had the great pleasure of listening to Zayna at the Center for Care Innovation convening in San Francisco last year. And I went up to the convening thinking I would be refreshed and re-inspired, but not necessarily going to learn something necessarily significantly new from what I already knew. And I sat down, and as soon as Zayna started talking, I realized I was really wrong and really lucky. Zayna brought us in the audience, and I hope tonight for all of you, on a journey that really stretched my mind, changed how I thought about the past and the present and the future, shifted the questions that I was asking, and really made me let go of some assumptions that I didn't even know I had. As I listened to her, I felt uncomfortable at times. I even felt angry at times, but ultimately was incredibly inspired to take away a new lens. And it has stayed with me since then, to think about what we deal with and face every day at Salud para la Gente, and thinking about healthcare and the health of our community, and more importantly, to think about tomorrow and the future. It's exciting tonight in particular because this audience is so diverse. We have not just different roles representing different healthcare institutions, but we also have cross-sector representation in community services, in government, and students who are just beginning in their thinking about their careers, and those of us who have spent a long time in our professions And with that, I think we have an opportunity to really listen from the role that we have in our institutions and our jobs and in our community. And I really invite you to sit back and enjoy the journey you're about to go on. And with that, I am very pleased to introduce you to Dr. Zayna Khayat.
Thank you. Oh. Thanks, Dora. I'm going to get you to write all my reviews from now on. Holy moly. Okay, so I kind of thought I was dessert, but there's real dessert over there. So, just go get dessert. It's no problem. I'm going to be talking. So thank you so much for inviting me here. You know, it's not just because it's still winter in Canada and it's gorgeous here. That's not why I came. I'm a huge fan of the whole California kind of community health sector. And so just to kind of come and share a bit of how I'm thinking is an honor. I actually you've already figured out the future. I looked at all of what's on the gallery. It's memorialized on Instagram. I just did that, so you can go see. Particularly these high school students, you guys get it. So I feel pretty good about the future. But you guys know what's going to happen. So what I'm going to do is just guide you a little bit to make sense of all the change that's happening, macro society, in healthcare and community. What I need you to do is just as you're hearing some of this stuff, just think about the work you're doing. And, you know, is some of this reinforcing the path you're on? That's great. Keep going. Is it challenging the path you're on? And that's where you want to kind of stop and think, maybe we should do some things a little bit differently. I'm very big on Twitter, so feel free, take pictures, and you can have all of these slides, of course, afterwards. So kind of just to start, you know, to frame what's the future of health, I don't use this word paradigm shift very lightly, so if you imagine what paradigms were, you might know Thomas Kuhn kind of wrote a book to look at all scientific revolutions and big paradigms in humanity, like that, that the Earth wasn't the center of the universe, it was actually the sun. And we had it all wrong for hundreds of years, that the Earth wasn't flat. There's a flat Earth society who hangs out with the vaccine society. But anyway, sorry, anyway. And that's kind of what's going on in healthcare, right? So we built our systems of healthcare about 150 years ago with what we knew at the time, right? Just like we build maps with what we knew at the time. Well, if your map is wrong and it doesn't make sense, you're not going to get where you need to go. And that's the shift we're going, you know, to a new paradigm that's not around the system and the clinics and the doctors, but to finally kind of rebase and redesign around the people who have the biggest stake in the work we do, and that's the patient. But what Kuhn showed is when revolutions happen like this, it's not kind of a linear, gradual progress. There's like a perfect storm of stuff that comes together and it just triggers and then you go. Once you know the Earth is not flat, you can't still work in a paradigm where it is. So I would submit we have three big forces that have never existed in 150 years of medicine, right? So the first big force, and this was captured by Eric Topol in his book, The Patient Will See You Now. He's a cardiologist at Scripps, is this new mindset of people and their families who have all the information, all the means of production and doing things with it, and are just not going to take it anymore, right? We've learned to be, let's call it consumers in every other part of our life. Why should healthcare be any different? And this is a new force to be reckoned with that just didn't even exist 5 years ago, and it's growing in momentum. So that's one big wave. The second force is, of course, you know, demand for services well exceeds supply. Available resources, we just heard that today with some pioneering moms to do something about it. You know, we know even if we had unlimited dollars to pay for the health care we need in the way it's currently organized, we'll never have the labor. We'll never have enough nurses, doctors, physiotherapists, occupational therapists, whatever it is. So when you have scarcity, right, when you don't have enough resources for what you need to do, that's a really good time to innovate, and we kind of have really hit that point. And then the third big force is that there's now technology to do something about it around this kind of massive unsustainability and this new powerful awakening of patients. And so when I say technology, I don't want you to be thinking about big machines and drugs and MRI. This is just software, okay? Software, zeros and ones. All it does, it scales. Software scales fast. What does scale mean? It means you can use it to get productivity or something out of it for no extra cost, right? So that's kind of that's the promise. And so if we think about this technology story, and I saw technology on a lot of those things there. You know, this is 2,500 years of medicine going back to Hippocrates, 500 BC. And every one of these kind of nodes along the journey were some pretty major new advancements that brought, you know, new ways of understanding the body, like, you know, anesthesiology and x-rays and imaging, policy innovation, like establishing the World Health Organization in the mid-1900s. And these were huge dislocations to our ability to kind of either prevent illness, manage it, treat it. But what they have in common, right? 2,500 years of progress that's doubled the life expectancy of society, right? Very, very successful, is they're all analog, right? They all can only scale linearly because things that are just made of stuff and can't kind of scale fast like software can only grow and learn kind of in a slow pace, which is kind of what medicine's done. Digital came on the scene about 10 years ago. 2008, it kind of started getting serious in healthcare. And that's about 10 years after the rest of society. You guys might remember kind of the late 90s, early 2000s when the whole e-commerce revolution came. So we're like babies in digital in healthcare, right? We're just getting our walking legs, but software scales exponentially, and that's why it's going to take off. So just to give you a sense of like the new way of thinking about just your health data. So Eric Topol, who's kind of probably the guru of this stuff, he just published a book kind of talking about what data is going to do in healthcare. It just came out in March. He talks about this new data, health data stack. And he says there's all these new cuts of information about people's body and health and biology that are well beyond what we've been using for hundreds of years, which is basically the medical record. That's called the phenome. That's in the far right corner. It didn't even make Topol's stack, right? Because these other slices that are coming from other new modalities and ways to understand what's going on are going to be easier, cheaper, faster to generate, without having to go back and redo the whole healthcare system to pull them out. So, you know, your expososome, the air you're around, whether that's asbestos or bad sun for cancer or smoking or whatever it is, all your omics, your genome, your gut microbiome, all the bugs in your stomach that actually tell your genes what to do, your proteins, your anatome, your imaging, your physiome, your Fitbit, all that data of how you move, when you move, why you move, changes in how you move, are becoming clinical biomarkers. Your socionome, your whole sociograph, your Facebook pattern, your Twitter, your Instagram. My children apparently have Finstagram now. Fake Instagram that the parents can't see. I just learned this from the high school teacher. Do you guys have Finstagram? Yeah, you know what I'm talking. Okay. Anyway, so that's the point, right? And we're still obsessing in healthcare with the medical record when there's this whole new opportunity. And that's, to me, a massive opportunity to not have to go undo things but start new. So kind of put that all together, these are the big shifts in healthcare. And as I go through these 6 shifts, and then I'll just do a few examples of them, think about which of them are going to be the most important for whoever are your stakeholders, whatever you do and whatever you work on. So the first huge shift, right? We design medicine, to actually be reactive. They often say we don't have a healthcare system, we have a sick care system. Because when we built our whole systems of healthcare, the population was generally young and quite healthy. And so it was, we built it and we funded it so that if things go wrong, it will take care of you. That's a sick care system. And so that's kind of not working for us anymore because we're staying alive. We're staying alive a lot longer, and we're staying alive a lot longer with all these kind of compounded complexities that are, physical and emotional. So the new future is going to be not only preventative, which everybody's talking about. In many ways, that's what you probably do. But now proactive, and then the new paradigm is predictive. Wow. Imagine if everything we did was largely around predicting what might go wrong instead of mopping it up when it does go wrong. The second shift is the precision. For all of the science and evolution and all these years of medicine, it's still pretty clunky, right? It's largely analog, it's still quite crude, and it's what we call a one-size-fits-all paradigm. So did anyone ever do like a 5K race and everybody gets the extra large t-shirt, which means nobody's shirt fits? That's kind of how we've organized largely health services. In the business world, we say this is a segment of one. That was fine because resources were limited and we didn't have any data, and all that is now changing. It'll be precise, personalized, and we will move from this kind of sick care system to an intelligence-based kind of system of wellness. Whole new way of thinking. So it's like from a segment of one to an N of one. The third big shift is the modality, or the location, or the channel through which people will get health services. So because it's been so analog, I think something like 75% of what we spend on healthcare is people, buildings, and capital. That's all analog stuff, right? So I think we're second only after the construction industry, right? And healthcare is an information sector. There's so much information, and it just doesn't flow because it's stuck in these analog objects. And so because of that, we've had to hold all the labor and the capital and the money and the buildings in buildings and institutions. It's been very institution-centered. And just like you no longer go to a bank to do banking, you no longer go to the travel agent to book your trips, and you probably don't even go to the store anymore to shop, that's coming to healthcare, right? It's just decentralizing, and then it'll be, this is your new fancy word from the Canadian, digital, okay? Digital means this kind of seamless interplay between the digital realm and the physical realm, right? So when you're at work, you don't say, I'm gonna go do my digital work now, and then email your colleague, and then, real work is when you have a meeting in person. You just figure out what channel makes the most sense for whatever your goals are. So that's kind of the new way of working that's coming to healthcare. Okay, the fourth big shift is the duration. So how much do patients get access to services? So again, because healthcare has been, very labor intense, needs a lot of resources, and we had to store all the expertise in these special centers and buildings, it could only be designed to be what we call episodic and intermittent, right? So episodic means come in, you get your 15-minute appointment, and then we got to take all those resources away because we're time sharing them so other people can have those little bit of resources. The two biggest industries that kind of are on the stock exchange that drive healthcare, pharma and medical devices, those are episodic industries. The whole industry, right? Diagnostics. You come in, you get the radiology scan. The company's not involved in your healthcare outside of that. Right? Same with drugs. They're just there for the therapy. All that is changing. It'll be continuous and much more kind of team-based instead of all these silos. Fifth shift is a massive power shift. So think of the whole model of care is quite focused on where all the knowledge sits and all the expertise and all the training with the provider. Right, for the long time, our patients are kind of these passive recipients of instructions and just meant to follow. And much like in, let's say, the education environment, the learner is not like just a passive part of the process, they're active. We're moving to the era of, and I don't say the word patient-centered healthcare because I think that's still too much to that side. It's people-powered healthcare, right? Where the people who have the biggest stake in what we do are in the driver's seat. They're leading and we're supporting. That is a whole different architecture to this work. And then finally, the last big shift is what I call the business model shift, which is really what we're measuring. Because whatever you measure is how you organize everything. And we've measured it based on cost, right? You know, beds, visits, people, inputs, activities, kind of a fee-for-service paradigm, to now kind of finally, because we can get the data, we can get it cheap. We couldn't do it before because we didn't have software, that it's now oriented around the result, the outcome. You guys might, you know, a similar example you might think of is, I remember Home Depot would say, we don't want to sell you the drill, we want to give you the hole in the wall, right? So you rent the drill or whatever, you're buying the results. That's kind of the idea, right? That, you know, those of us who work in this sector will get paid when we deliver health, not because we did the activity. That is a massive, massive shift of how you organize things. Okay, this is a lot of change, and it's coming. A lot of this probably exists, the stuff to the right, in your sectors, in what you do, but it's not the dominant paradigm. And remember Thomas Kuhn, and when software is kind of underpinning everything, that's when it moves fast. So just a couple examples. So we all know what causes health. Like if I took the barometer of the health of this room, very little has anything to do with the medical care you've accessed. It's your zip code, which leads to how you eat, sleep, drink, smoke, which mingles with your DNA, yet almost everything is kind of invested in medical care. And you know, that's great, because if you do get sick, you absolutely want services to take care of you. But what's now happening is a lot of the players that have been in this space are moving upstream because they know that's the best way to create health. And so a whole shift of resources and talent and focus into the drivers of health instead of mopping up the mess. Where this will go is this idea of predictive health. So if you imagine this is kind of a typical trajectory of, you know, sore throat and fever, and, you know, you should have, you know, done something about it. Maybe public health should have kicked in, like a flu virus or hand washing, I don't know. But things get worse, and then now you're into medical care. You're at the doctor, you're getting antibiotics. This has kind of been the paradigm, right, for a really long time. What's different now is just by existing as a human in the digital world, whether you want to or not, you're producing a digital exhaust. That's your other fancy word. Let's make a list. Digital exhaust. You know, maybe you kind of looked on Amazon for some Sudafed, or you kind of commented on Instagram that your body's achy, or you used to walk a certain speed every day, but now your watch is saying, all that data is getting mined and crawled through to predict with pinpoint accuracy well before symptoms or any danger zone, you know, that something might go wrong. And then a business model is being designed here, a care model here instead of here, right? So there's now published papers of just by data from kind of your digital exhaust, schizophrenic episodes, hypoglycemic episodes, cardiac arrest can be predicted, and it goes on, and there's just study after study, because these studies are going to come out quickly because they're just based on digital data. They don't need to do a huge clinical trial and get all the, you know, infrastructure. So that's kind of the future. The other part is, you know, I talked about this shift of precision. I mean, it baffles people around the world how much of waste is happening in kind of healthcare in general, and certainly in this country. So the Institute of Medicine kind of added it up, all the places where, you know, something like 30 to 40% of what we do is either not necessary, duplicative, harmful. You know, we're paying way more than we should. And I lived in the Netherlands with my kids, and I was like, oh, that's like the whole economy of the Netherlands, you know, is wasted on an annual basis in this country. You know, try to run any organization on a 30 to 40% inefficiency, they wouldn't be in business, right? And that's kind of this breaking point we're at. So with some of these tools, this paradigm can change. Okay, so on to this modality shift that I talked about. So look, this is what we built healthcare on, all these like analog things, right? Bricks, people, paper, pens, fax machines. Do you guys still use fax machines? Oh, shoot. Okay, un poquito. So we have an Axe the Facts hashtag, and like we're the whole anarchy. I have this whole dream that like we're to get all the faxes when they stop and like grind them and then make art out of put some resin. Anyway, that could be next year's project. So I was teaching this semester at the university. I have 3 medical students in my class, and they each have 3 pagers. I was like, I have to add pagers to my slide. You guys know who use pagers in the world? Who the market is? Doctors, drug dealers. That's it. And these, us, and lawyers. No problem. Anyway, so pick a D. Okay, this is what's happening. All of this is dissipating, right? Just like every other industry. It's dephysicalizing, which means it's miniaturizing. It's getting decentralized, disintermediated. What that means is we created all these experts, different stacks of types of doctors, types of nurses, physiotherapy, pharmacy, and then primary care, acute care, long-term care, all these silos. Those expertise don't make sense for the kind of complex issues our patients have. And so that's kind of getting disintermediated. And then digital. So just some examples. So my boss in the Netherlands just wrote this book to kind of capture everything I'm telling you about, probably a lot better than I am. So he would kind of go to his conferences and poll the room and say, okay, where do you think in 10 years good health care will be received or given, right? And very, very few kind of think that you're going to have to go to some place to get good health care. That's in 10 years. So conceptually we get it, but it's hard to tie ourselves to this kind of new paradigm of care anywhere. It's not like this is like magical insight. You guys remember the Jetsons? You guys don't know what this is, but this was a TV show in the 80s. But, we already imagined this concept that, you didn't need to be in the same place at the same time as your clinician to have good health care. I don't know why he's wearing a mask on his mouth, but so we kind of knew it, but we're just not there, right? But we're getting there. So there's a great, Dr. Jay Parkinson started this company because as a general practitioner, he just couldn't believe, because he's a doctor who's what we call a digital native, which means all these docs ever knew is how to be digital. And then he's like in a time warp when he's in healthcare. So he started Sherpa Health, which is basically a completely digital first primary care practice. And it's really just texting and emailing, to kind of figure out what you need. And then sometimes you might need to see the doctor, but it's not necessary. So these guys just got bought by a huge health company in the US. And then, Babylon is a kind of a similar service out of the UK, which, can also have a video option if it's needed. But what's fascinating about Babylon, so Babylon is the way that anybody in the UK, which is 65 million people, I guess that's probably the size of California, I think, one public health insurance plan, 24/7 instant access to a UK-trained doctor through the Babylon app, but an AI, an artificial intelligence, first does all the questions with you to triage, and then only if you need a clinician do they kind of bring you into the app. And then if you're kind of talking to the clinician and you might need an antibiotic for your kid, literally if there's a drugstore around the corner, you just go pick it up. Right, that service is now available for 65 million people. And I'm going to come back to Babylon because I have an idea for you. Okay, the next level though is forget the clinician, right? So there's these new kind of suite of augmenters to health professionals called digital assistants or digital companions. So I don't know if you know the story of, who's got an Alexa or a Google Home? Yeah. So these things have penetrated the market faster than smartphones. 90% penetration, way, way faster than smartphones, right? We're onto something. But when they looked at what the use cases have been, what everyone's doing, it's all for older adults to manage their medications, right? So now, did you guys see the news this week? They just got HIPAA compliance, which means it's basically a medical device to do clinical kind of diagnostics and stuff. 6 different kind of clinical use cases can go through the Amazon Alexa. We took advantage of this kind of dynamic And young people SMS a lot. Well, we work in home care in my company. We do 20,000 home visits a day, mostly for seniors. Who takes care of those seniors are family caregivers. Most of them are 50-year-old women. And we're very tech savvy and we're very stressed. So we created a chatbot for mental resilience for the caregiver. Not for the patient, but for the family caregiver. And we made a personality. We call it a botsinality around her, Elizbot. But this is 24/7 access to CBT in an SMS text platform for free, right? So scale. The next level is not just a bot or a voice, but an avatar. You could put Brad Pitt, if you want, as your health coach, or me, whatever, something. But this company, Sensely, has developed this as a coach for people with diabetes and hypertension, and they can scale this, right? They don't have to hire 1,000 people. It's software. It's free. Highly customized, and it shows empathy in the face, in the eyes, in the tone, in the literacy level, the language it uses. All that can be adjusted for whoever is using it. And now where this is going to be common, is not just kind of an avatar or a bot, but a digital human. So this is Nadia. I wish I could show the video. She is so real. And in Australia, they now use her as their, let's call it, call center for people who are on disability insurance. So people who were born with a birth defect or had a big accident where the state is paying for them to be alive, like their welfare. Terrible experience for these people if they have a question about their livelihood, their money that they have to get, especially if they're not at the right literacy level or cognitive level. She is 100% empathetic. She reacts to your face, your body, your tone, your language, and the voice is Kate Blanchett. So it's very, I would call her. That was built by a company called Soul Machines in New Zealand, which is really in the movie industry. So all these industries are blurring. And then the ultimate, this is now, Microsoft has this available, they're testing this in Australia, that this is a hologram. You remember like Star Wars with R2-D2, and that's that. And so, we work in seniors care, so you can now bring the clinician or whoever, social worker, wherever your patient is at, right? And they can see them and touch them and all that stuff. And this will be free and very, very easy software. So I'm just going to skip this for time. So the next big thing that's happening is we don't need to wait to go to the clinic to get the blood work or to get this test or that test. The clinic will come to us. So these are this concept of sensors. They're in the bed sheets, in the floor tiles, in the ceiling, in your body, on your body, just gathering the data and telling us when things look off track. This is allowing us to take a lot more control of our care. So I stole this from Kaiser Permanente when they came and schooled us in Ontario on their health system. This idea that about 80% of what had been relegated to formal medical care could be managed by people in their communities if we give them the right tools and information and empower them. And so, we hear things like patients are the biggest untapped resource of healthcare. So, in the energy sector, we talk about wind and solar as this renewable resource. That's this kind of untapped potential for people to be empowered, especially when they move, peer-to-peer. You guys probably know Susanna Fox. So these are the kind of tools that are now kind of coming to your house. All these diagnostics, X-ray, urine test, eye test, HIV tests, flow cytometry are now in these kind of very small, miniature additions to your phone. And these used to be in buildings where there was a technician and a big machine, and that's all kind of dissipating. I'm just going to skip this for time. Okay, so this is kind of the change that's coming. I hope this excites you. It might scare you a little. All of this is in the market today. It's just not at scale. And I know some of you are thinking, no, we work with, low resource or safety net. We'll never afford this. No, actually, my point is you can absolutely afford this because it's software. It's free. We just saw today in the news, you can get any radiology scan now for free. There's a free service online that uses an AI to replace what a radiologist does for kind of routine diagnostics. And that's just going to get easier and easier. So that's the future of health. Okay, so what does it mean for you guys? I'm just going to go through a few examples of what gets me excited of how people like you are embracing these. A few strategies. So the first strategy is to kind of embrace these shifts, but do what I call is niche out. Niche out means find a niche, focus on something and do it really, really well, and change the whole paradigm of how that's done. In the Netherlands, we had entire villages of just dementia patients, dementia villages. So imagine if you designed a city for everybody with dementia. That's what this is. They're in Denmark as well. Purple Clinic in New York, she's an amazing primary care doctor. She started a clinic for women who've had sexual trauma. Incredible results. Chinese immigrants in Seattle, children in key neighborhoods in Harlem. Tons of really neat stuff. In Toronto, a bunch of our docs got together and formed their own healthcare system for homeless people. Nobody's going to bug them. They just did it, right? And we built a hospice for homeless people with them. And then, of course, Sidewalk from Google just set up a city in Toronto that's a 100% digital city with a focus all on vulnerable populations. Another huge strategy, completely new models of primary care. I don't know if you recognize some of these, like CareMore, Iora, Oak Street. Just docs that said, I'm not going to do the way it's been dished to me. I'm going to build a different way to do primary care that integrates social determinants, and they're scaling like mad. So great kind of franchise model. We've been working on a model that has yet to come to North America called Burts Org from the Netherlands, which is a management-free model of doing home care. So imagine all your frontline staff, no managers. That's how Amazon is organized. So it's an organizational innovation where you're just fully empowering your frontline staff to do what they got to do in the community and just giving them all the resources. So we're about to test this right now in Ontario with 1,000 patients. We're seeing all these traditional medical players become, social determinants of health players. You probably know a lot about what Kaiser's been doing. They just announced 400 housing units that they're going to build for the precariously housed, food markets, United is in employment, transportation, housing, et cetera, et cetera. So all these traditional players are now building business models and care models way, way, way upstream. A lot of them are kind of getting into housing and real estate. So a lot of health institutions, I don't know if it's the same here, they sit on a lot of land. And so now they're using that land as an asset to kind of build housing. And it actually has a really good business model. So this hospital in Ottawa built 250 affordable housing units on their land, and they made more revenue off their housing than their hospital, and now the housing funds the hospital. Another big thing we're seeing, I don't know how much you do, is getting into policy innovation, like very seriously policy innovation. So for example, our women's hospital in Toronto, they're working on the income gap of women. I don't know how big it is here, but it's really bad in Canada, in every profession. Because if they make women more wealthy, healthcare gets better. So instead of fixing their hospital to be great, fix the income gap through policy innovation. So basically, there's a great study of what's happened in all these communities that have innovated on community health. And these seem to be the raw ingredients, right? Multi-sector, it can't be within health. You got to have all these different industries together to solve your problems. Data, change policy, and really think creatively about your business model. So just a couple examples to show you this idea of partnering with what I call unusual suspects. Uber, so in healthcare, there's a lot of people say, I'm the Uber of healthcare. Like you can call up a doctor or call up that, but Uber is the Uber of healthcare. They have a whole company called Uber Health now. And so they have a service where they can kind of do medical transportation. Maybe some of you use it. But now they're doing staff transportation to get staff to work, right? With a really neat business model. This one fascinates me. So Lyft just announced a week ago a $50 million fund that local communities can apply to get, rides for homeless people, even bikes, because Lyft has a bike business, right? So if transportation is an issue in your community, you can get like new partnerships here, and there's just some fascinating stories about that. Oh yeah, I want to go back to Babylon. Remember Babylon in the UK? So Rwanda now has access to the whole Babylon platform. So if you're in Rwanda, you have access to UK-trained doctors within 30 seconds of needing a primary care doctor, paid for by the government. 400,000 Rwandans have access to this service. So my dream in my country is to bring this to our First Nations, our indigenous populations, and they'll have better primary care than I do, because I have to call and wait and drive and park and all that stuff because we don't have a virtual option. So just think about new types of collaborations. Libraries, barber shops, restaurants. Sacramento has done a big thing after Anthony Bourdain committed suicide to kind of rethink the role of the restaurant as a place to create mental health. All these unusual suspects coming into healthcare, the Red Cross in England, postal workers. I don't know what your postal workers do, but there's not a lot of mail these days. And in some communities that aren't growing, that have a lot of seniors, they've seen the same postal worker every day for like 30 years. They know the family, they know the house. In France, in England, they're doing home care visits, wound, antibiotics, checkups. So they've changed their business model because they don't want to go out of business. Firefighters in Minnesota. And then finally, there's these guys. These are the big tech giants. Every one of them has decided healthcare is their next major. They're not getting into energy. They're not getting into education. They're all getting into healthcare. They want to fix it, and there's a lot of money to be made, apparently. But you can partner with them, because what none of these guys have is access to patients and all the knowledge you have of your communities. But they have a ton of resources, and they can help design some pretty slick stuff, but they can't deliver care. So some examples: Ford Motor Company is now a medical transportation company, right? They built a new business line to kind of get into that space. Goldman Sachs, I don't know if you guys have seen this. The founder of Goldman Sachs, his name was Marcus. So this is the huge investment bank. They've created an entire bank for the unbanked, right? To get people access to money and capital, et cetera, called Marcus. Of course, the telecoms, Apple, Walmart, Amazon, everybody is piling in to bring solutions to this sector. All right, so I'm going to kind of wrap up there. So my last kind of thing here, which is represented here, is all this stuff is great, and it can be awesome for your patients and be great, but the hardest thing left to do, in my opinion, is find new ways to get money. If you think you're going to do all this stuff and still kind of just ask government to give you grants or Medicare or whatever, you can do that, but it'll be hard. There are some amazing new ways to finance new models of healthcare in the community, private equity funds, new kind of capital, co-op banks, endowments. There's lots of new ways to do it, and that's kind of going to be the next capability you're going to need to be building if you haven't already on your teams, is these kind of new finance innovation, which will open up so much opportunity for you to do the important work you have to do. Thank you very much. You've been very patient with me. Okay, questions? All right, we might have time for a couple questions, 5 minutes. And then otherwise I'll hang out a little bit afterwards, and you can ask me questions. Any burning questions or comments? Yes. I love it. This is a student, right?
Yeah.
Who are you? What's your name?
My name is Luis. I'm from...
Oh, here's a microphone, dude. Bye.
My name is Luis. I'm from the Baltimore High School Health Academy. I have a question saying, if everything is going to be digital, will the future of health care careers become non-extinct?
Okay, this is an awesome question. So when the calculator came out, they're like, oh no one's going to be able to do math now. All right? So all the data has shown whenever, another great example. You guys remember phone operators? Okay, so remember when phones came out, okay, you kids are going to think this is crazy, but when phones came out, In order to make a phone call, you had to kind of call into the phone operator who then connected you to the person we want to call. That's how women got in the labor force. It's all women were phone operators. They figured out, because the phone was a beautiful communication tool, kind of like our new phones, that the rate at which everyday people were getting phones in their house, they're going to need more operators than people in the population. That's what healthcare does. We just keep adding resources because, then the switch came out. Overnight, that entire workforce was gone. But what happened? Women got in the workforce. They recycled into the next thing. So the answer is, in every sector of the economy, wherever digital came in and replaced whatever labor was doing a task that a machine could do a little bit better, jobs got created. They didn't get destroyed. They got created. So that's the opportunity. So the saying is, a radiologist is not going to get replaced by artificial intelligence, but a radiologist who doesn't use artificial intelligence will get replaced, right? Good question. That was really smart. Holy moly. All right, maybe we'll wrap up so you guys can finish the program. Oh, I could talk all day. Any other burning question, you students? Okay, one more. I love that the students get the voice.
Thank you. My name is Amber, and I'm also from the Watsonville High Health Academy. And in a slide, I think I heard you mention that what we're practicing now isn't suiting what the people need.
What the population needs, yeah.
And I was wondering, for those who are wanting to go into the health, the medical field, what we should be focusing more on and studying more.
Yeah, okay. So everyone should learn how to, for sure, on your side, you don't need to go to school for this, how to code, right? Like this, you just remember typing is what we had to learn, keyboarding. This is like the new thing. So just really, really good digital skills. That's just a given. That's like breathing oxygen and walking. So the new areas that they're saying like we're gonna need the best thinkers on is ethics. Right? This stuff is going to open up questions about ethics we can't even imagine, okay? And so we're going to need so much capability in that area. And I would suggest anything where you're integrating. So if you're going down a path where you're going to silo yourself, like just be this kind of doctor in this hospital and don't talk to, anything that's cutting across, and not just within healthcare, but to housing, and to employment, and to the city and the built environment, those types of capabilities are going to make you a rock star. So in the business world, we call it integrative thinking, where you can look at this and that and put it together really quickly. So that's what I suggest, which just means get some practice solving really messy problems as much as you can in your training, and then you'll kind of save the world. No pressure. Yeah? Okay, thanks you guys. This has been really fun.